Right. So normally I take attendance and do all that, but given the nature of the subject matter, this kind of hit me a little bit more. And I said, I think my students might even want a break too. So I said, let me record this. We weren't able to get a speaker this week, but I did want to still cover the subject matter and have us moving forward with the information, which I think is extremely important given this point that we are in this semester and where we're moving along. Just a couple of announcements. Some of you have let me know that the email isn't quite getting to you. So when I do the email, I'll also post it as an announcement. So check your announcements. And I'll try to work with IT to make sure that that works better. So far, most of you are getting the emails, but not everybody, and I'm concerned about that. So I want to work with SDSU IT department to figure that out. So I'll be working on that this evening and tomorrow. And the assignments, I'll be grading those, making sure that you're up to date and so you know exactly where you're at. So everybody who looks at this video gets attendance points for this. So I'll be posting this as well as kind of checking in with you about it as well. So let's go ahead and get started and I'll share the screen. You can see why, given the subject matter, it was bringing up things for me, myself. And so I wanted to be transparent about that as we're talking about stressors and other things. So let me pull this up. So I'm sharing the screen here. And this is on stress, burnout, and self-care, right? So, it's gonna take a moment to breathe, feel my feet, feel the weight of my body in the chair. Breathe in and breathe out, and I'm encouraging you to do it with me. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out one more time. All right, so we did that for about 60 seconds. I breathed in and breathed out about 5 times, and that's called the 60-second fix, which is something my good colleague and friend, Dr. Reginalina Milrose, worked on. She has several other books, but some of what she looks at is resetting people's brain during stress or after trauma, and a large part of it has to do with breathing. And she's looked at some research and has replicated that research to show that after 21 days, if you work on your breathing in a similar manner, you will be able to reduce your level of stress because you become more aware of how to remain calm and take control of your autonomic and automatic nervous system, as it were. So many people have individual sources of stress, right? And striving for perfection. I'm going to pause right there because many people on their way to graduate school are striving for perfection. An excessive need for approval, given how you were raised or how you're wired, right? Sometimes you're driven towards this approval. But usually it has to do with some developmental stage where somebody was really, you responded well to approval, and either it was given in copious amounts or was taken away, but you're working on this excessive need and concern for approval. Right? The next is self-doubt, right? And each of these can kind of play into each other, or they may be a separate issue, but then they may be more salient for each person, but doubting themselves, and sometimes that may look like imposter syndrome, right? Physical and emotional exhaustion. And this physical and emotional exhaustion sometimes can be re-triggered by similar experiences. So I want you to catch that piece, right? It isn't just that, well, I'm working too hard, but it may also bring about a prior trauma. And I've seen this happen when people actually learn new things that are cutting at the core of who they are. And their identity, right, is shifting, and an emotional exhaustion takes over that may also look physical as well. And psychosomatic issues or a psychological issue, as a psychologist, I've never diminished that. Like, that is real for your body. And sometimes the response is to be able to deal with it psychologically, but other times you can only deal with it medically. right? Assuming too much responsibility for clients or people that you serve, whether they're students or patients, however you call them, but assuming that you can fix them, right? You can't fix anyone. Ruminating about cases as well. Yeah. And really what we do is provide a path for them to heal on their own. But you can't really fix someone. Even if someone breaks their leg and a surgeon puts that leg back in place and sets it together, there's some healing that has to happen in that person by themselves. I'll say that again. Even if someone goes through a trauma and their psyche is in pain, and you can maybe provide an environment by which they can breathe better and feel safe, or at least know that they're safe, but maybe not accept the feeling, that time comes on their own, right? So ruminating about cases. Sometimes you cannot do anything about it, but you may go over and over it again. And there needs to be a cutoff. You need to have a boundary. If not, you'll merge into their stuff, and that's bad too. It's kind of like you're offering pure drinking water and then you're pouring into dirty water and back and forth and then trying to offer that. It gets worse, right? So there's many environmental sources of stress, right? And many of these I'm sure you may have experienced in the work setting, like organizational politics, excessive demands of agencies, and constant paperwork, right? And the paperwork can morph and change from year to year, and you have to make sure you're filling out things just right because the state or the federal government wants it this way, right? Restrictions imposed by insurance companies. This is a uniquely American problem. I'm sure it may happen other places, but definitely happens in America that insurance changes and gets updated, and it creates sometimes roadblocks to people getting access to healthcare. And the quality of working relationships with your colleagues can also be an impact, right? And sometimes it can begin about how you perceive what is a good working relationship, but it also can happen if that working relationship changes in the transitions. Definitely difficult client behaviors, and they may be behaviors that trigger your own issues. I'm good with about 99% of any behaviors that I've seen in various mental health and psychological settings. The one that just bugs me is young people or older people destroying property. Why? Because I used to do it. So, yeah. But being aware of that can work with it. But if you're not aware and if you don't try to address it, this can become an ongoing thing for you as well. So stress and burnout, how stress paves the way to burnout, right? At work, it tends to impact your personal life. And if it impacts your personal life, you're going to burn, like they say, burning the candle at both ends. That's what's going to happen. So working intensely with people opens you up to your own wounds, right? And I was just talking about it reactivating earlier conflicts and pain, right? And usually that's some level of unresolved trauma or unresolved issues that you may have, or just a wound that you carry with you, right? And then constant stress and not taking time off to release that stress, if it's not managed, it can result in physical and psychological exhaustion. Stress from racism, stress from sexism, stress from homophobia, stress from being in an environment that's never welcoming, never approving, never supportive can lead to this physical and psychological exhaustion. So understanding burnout, right? This condition is characterized by physical and emotional exhaustion and depersonalization, but you may feel detached, right? Another way to call it is disassociation, right? But first it begins with depersonalization, right? You feel like you're an object, or you're simply a worker and not a person, right? That's that depersonalization. And you may not be acknowledged or appreciated for your personal accomplishments or your personal contributions to a team, let's say. And so some of the related conditions, compassion and empathy fatigue, eventually you just don't care anymore. And then the secondary traumatic stress coming from observing ongoing traumas that are happening to clients, but also vicarious trauma sometimes, You're with people who are in a lot of pain, and you take on some of that pain, right? So there's internal and external sources for sure, and which can lead to impaired professionals, right? Helpers are challenged with recognizing signs of burnout before they become impaired practitioners. Impaired professionals are unable to effectively cope, right, with these stressful events and to adequately carry out their professional duties. Impaired practitioners clearly contribute to the suffering of their clients rather than alleviating. And I'm reading through this, so I'm giving you a frame by which I'm going to tell my own story when I was working as a school psychologist. And I had seen in 1 month, I saw 10 suicidal ideation cases and had to take either those young people to the hospital or take them home directly to their parents and make sure that they followed up with mental health care. But a lot of times it was brought on by some type of awful abuse, physical, sexual, ongoing verbal abuse, but also neglect. But it led to these young people having suicidal thoughts and needing to be hospitalized for those suicidal thoughts, or at least seeking treatment. So 10 cases is a lot. So to give me an idea, I would usually see one a month. But after that month, I'd seen 10 cases. I realized I was beyond burnout. I was impaired. I could not, my level of empathy, because I've been pushing through each one of those. So my level of empathy and my ability to kind of see and discern what was going on with the young person was greatly diminished. In almost every case, I thought like, okay, is this kid gonna go to the hospital? And I couldn't really function. So what I had to do is take myself out, and I would do all the paperwork, but I couldn't do the severe cases. So what I did is I called in some other professionals who were able to follow up on those cases. And I just took a month off so I could reset and be able to be in the game again, right? But this issue of impaired professionals is real. And if you are in the mental health field, you need to be able to find those outlets. Once that happened, I was able to find a lot more outlets that I needed to keep in my life. Seeing a counselor at least twice a year so I can get out all the stuff that was being put in or things I was observing. Continuing to have a regular, athletic activity or exercise routine, and eating a much better diet, getting better sleep, all the important things that you need to do, but making sure that that was just as much as a priority as it was for me going to professional development, that type of thing. Right. So again, I'm talking about these ways of preventing, but let's break them down even more. Right. Self-care is a human requisite, a clinical necessity, and an ethical imperative. Right. It was ethically right for me to step away from what I was doing after dealing with an unusual amount of cases. Right. So if people are keeping data, you can know when things have gotten unusual or out of hand. You're able to talk with your colleagues about that. So there's no easy answers. So you need to find ways to retain your vitality personally and professionally. So develop a strategy for coping with stress and dealing with burnout. Not only do you know yourself, right, in regards to what's going to work best and how, and so if you think about how will you know you're getting better? So you have control of yourself. So assess your current behavior and see if it's working, right? Strive to develop these realistic expectations based upon your goals, but also based upon your supervisors' ideas about where you need to be going professionally and specifically as it relates to seeing clients. Learn professional strategies for managing stress, such as there's meditation, there's mindfulness. For some people, there's prayer, which can be a part of both of those. For other folks, there may be Zen type activities. For me, martial arts has always been both of those, and I usually do meditation as a part of my regular practice. Same with surfing, right? You may find something that gives you that space where you're able to get rid of your phone and really dial into who you are, so you're able to like do a self-assessment without a bunch of extra noise. Realize you are one person and avoid taking on too many projects, right? And that can come with developing clear priorities about what's the top 5 things that are important for you to do in your life, right? Then you schedule those in and other things will fit. But if they don't fit, then maybe one of those top 5 needs to take a back seat for the time. And now you're at 4, but you're working on this newer area that you're developing. So realize you're one person and avoid taking on too many projects at once. I'll say that again. And my sense is that from Generation X on down, we've been a little better at, let's say, the baby boomers or the silent generation who would just work themselves into an early grave. Gen Xers saw what their parents did, and I'm a Gen Xer, so I'm looking at what my parents did. They worked the same job for 30 years, 6 to 6 every day. I just said I'm not going to do that. I need to find some other balance. And my kids, I know, they're going to have even more of a balance. So learning and practicing time management will be extremely important for your overall balance. A lot of other countries outside of the United States do really well with finding that balance and supporting their workers. So it's good to know what the policies are where you work, and also if they say work 40 hours a week, my strong suggestion is to find a way to work only 40 hours a week. If not, it will have backwards effect if you do it too much. Once or twice a year, I get it. But every week, 60 to 80 hours a week, you will burn out. So next, find other sources of meaning besides work. And as I mentioned before when I was talking about Durkheim and meaning in life, right? You can't only be about your work. Work can be a very important part of your life, but it isn't everything of who you are. Again, having control of yourself, respect your own limits, and we make self-care a priority. Now, you don't have to say that to your supervisor, but you do need to take that time for yourself. But sometimes I think it's important to say, I've given 40 hours this week, and I need to rejuvenate, right? And that you can say to your supervisor. But what you do for self-care, that's up to you, depending on the environment that you're in. But if it is an open and supportive environment, maybe you do share those kinds of things, and maybe you get involved with some of your other coworkers. Maybe not. Sometimes you really want that separate. I'm one of those people who likes my work very separate from my private life, right? Strive for variety within your job. One of the things I love about mental health, there's always something different, given the nature of the clients that we serve. So I don't think I ever had 2 days in a row that were the same as when I was a school psychologist. Always something different. Now, there may be certain rhythms to the parts of the school year, but given the nature of working with people, there's so many different things that you can look for to change and update and grow and expand. So build linkages with colleagues and friends. So my dissertation was on social capital networks. I'm gonna pause here for those who wanna write that down, because this is a strong way to develop a network that can work on behalf of your students and on behalf of yourself as you climb professionally. Develop that network, it's extremely important. Watch for those signs of burnout that we talked about. Treat yourself as you want others to treat you, right? And I'll even say, we teach people how to treat us, right? Recognize that you can be an active agent in your own life. Yeah, you have agency is one of the 50-cent words that we like to use in the academy. You have agency over your own life. You have self-determination. You can speak truth to power with clarity in regards to who you are when you know who you are. So take that time. If you're not taking that time, other people will define your reality, right? I hope that was helpful, and I hope you're able to think through some of those things as you are even now a student, right? And as you prioritize, as you work through time management. That's really what college, a lot of it is about, is people accepting and understanding that you've been through a rigorous process to help you better understand who you are and how to solve problems for others, really. And especially if you're going in the helping profession, you want to know how to problem solve. That's extremely important. All right. Again, if you have any questions, you want to follow up with any of this, please let me know. Man, I miss seeing you in person, but I thought this would be a good way for y'all to take a break and for me to take a break and to take some time for you to do some self-care. All right. Have a good one.